good. How are you? Nice to see you.
I'm good. I'm good. Yeah. Are you excited to be back in school?
Kind of. I like school, but I don't like waking up early.
Yeah, I'm the same way.
Yeah, it's tough. Thank you so much for taking the time to do our meeting. We're very excited to have you.
It's my pleasure. Thank you for inviting me.
Yeah, of course. So, I guess we could get started. Please join me in extending a warm welcome to Dr. Qureshi, an esteemed double board certified anesthesiologist at the Velasquez Pain Relief Center with locations across Las Vegas. Dr. Qureshi received his undergraduate degree from George Washington University, his master's in medical sciences at Drexel University, College of Medicine, and went to medical school at the Philadelphia College of Osteopathic Medicine. He received his residency in anesthesiology at one of the top 4 hospitals in the U.S., the Cleveland Clinic Foundation. Dr. Qureshi has also authored scholarly articles about the topic of anesthesia and has a double certification for anesthesiology and pain medicine. We genuinely appreciate him taking the time out of his demanding schedule to engage in a fireside chat with the GVHS Medical Society. My name is Brianna, and I'm the president of the GVHS Medical Society. So, as our first question is, as a highly successful anesthesiologist, what advice do you have for our members who aspire to excel in the medical field, particularly in the area of anesthesiology?
Well, it's as you know, Brianna, it's a once you kind of dedicate yourself to the medical field, you have to kind of figure out for yourself where you fit into that mold of medicine. What drives you? Like, do you want to? Is it more surgical? Is it more investigative? Is it more research? Once you've kind of narrowed that down, you look at the more logistical issues. If about your quality of life and how you want to manage your time. And based on that, as you rotate through medical school, as you go through all the rotations, you get a sense of exactly what you want to do with your life. So for me, I didn't want to be in a field that was like, very demanding time-wise, like surgery, but I also didn't want to really be in the field when I'm not using my hands, not doing procedures. And it gives me a quality of life where I can kind of do what I want in the way that I want. And anesthesiology is perfect for that. You can actually, once you have your training done, you can work anywhere, whether it's an academic center, higher practice. If you just want to, work locum tenens. I have friends that, they go to Hawaii for a few months, work there. They go to Alaska for a few months, work there. They go all over the U.S. They can just pick up and go. So that's what drove me initially to anesthesiology, just the freedom to kind of do what you want to do. But as I went through anesthesia, now I do pain management. So that's kind of what I enjoy. It's very hands-on. It's a procedural field. So your day is dedicated to being in the office, doing procedures, helping patients regain functionality, and that's kind of like what drives me, and that's kind of like my MO for life right now, is helping these patients heal, get through their pain, and able to live more functional lives.
Yeah, I really agree with that, especially with sorry about the announcement, but especially with the doing medicine kind of abroad. I went to UCLA for this medical emergency medicine program where our teacher was like an EMC at one of the hospitals in California, and she told us how a lot of her friends would kind of do the medicine abroad, and it's cool because you can sometimes you can pick where you want to go, but other times you could kind of choose somewhere where they need the help the most. Yeah. And I'm considering doing that when I am, if I ever get the time, I wouldn't mind traveling to somewhere abroad to kind of help out where they need it most. Because that's seems like a really good experience to have in life,
And, obviously any especially for working abroad or let's say if you do pediatric surgery, populations of refugee camps as they're getting bigger and bigger, a lot of those people need the help, and a lot of that's provided by specialists, especially from the U.S.
Yeah, that's awesome. Thank you. So now Liz is gonna ask our second question, and I'll let her
Yes.
introduce herself.
Hi, I'm Liz. I'm the treasurer, but I'll be stepping in for the vice president today to ask her question.
Awesome.
So my question is, can you describe a typical day in your role as an anesthesiologist? What are some of the key responsibilities and challenges you face on a daily basis?
So that's a great question, Liz. So, right now, as you know, I'm more interventional pain, so I don't practice anesthesia per se anymore, but I've done enough where I can tell you what the daily day is like. Again, it depends on whether you're working in an academic center like a big hospital or you're working in private practice. It's usually your day starts early. So if you like, if you don't like waking up like early in the morning like I do, or it's a little bit challenging, but you read your cases the day before, so you see kind of what you're dealing with in terms of type of procedure, your patients, you look them up, you see what their comorbidities are they healthy, not healthy, what type of surgery you'll be doing anesthesia for, what are the potential risks, complications. You have to prep all that the day before, and once you get there in the morning, you set up your operating room, you make sure you have all your emergency medications drawn up, you examine your patients, you sedate them, perform anesthesia, help them recover, and then the day just goes on very quickly because you're dealing with many cases. But if you're doing more higher risk surgeries like cardiothoracic surgery, anesthesia for that, and those are usually a long procedures. And it's very tiresome procedures because you're dealing with a lot of different physiology. You have to know your anatomy very well, physiology, especially for the heart and kidneys, very well. You manage those patients while they're sedated. You're basically taking over the function of different organ systems. You're just not putting the patient to sleep per se. You're taking over the role of their mind, their brain, their lungs, their kidneys, their liver, all those organs. Like you're responsible to taking care of all those things. So it can be like a long, stressful day, but at the end, once you recover the patient and they do well, especially after complicated surgery, it's a very good feeling, and you go home very satisfied.
Thank you for showing that side of anesthesiology. Basil's going to be asking the next question. I'll let her introduce herself.
Absolutely.
Hi, I'm Basil. I'm the secretary. My question is, in our mission, we aim to provide aspiring medical professionals with a glimpse into various specialties. What inspired you to pursue a career as an anesthesiologist, and what aspects of your job do you find most rewarding?
So that's a great question. It's as I was growing up, I was always drawn to the medical field. My dad's an internal medicine doctor in a small town. I kind of grew up in that environment. My sister's also a hospitalist. So it's kind of we learned through our dad. Seeing him taking all his board exams, and all the good things that we lived in a small town, so almost everyone knew him. So just he knew all his patients. He took care of his patients. It's just interaction between patients, physicians, kind of really drew me towards medicine. And as I progressed through high school, towards undergrad, I was also an EMT as well. And then kind of just solidified, my goals in life to be a physician. And then I applied to medical school. I did a master's before that. But as I went through medical school and went through all the board exams and rotations, and I really figured out what I want to do with my life, and I pursued that. And it's been very satisfying since. Anesthesia is a great field. You have a lot of freedom, like I discussed before, in terms of how you want to practice, where you want to practice, what type of practice you want to do. So if you're more mobile, you don't want to sit around one area or just do one thing all the time, then it's a great field to be in.
Yeah, thank you for sharing that. I think it's really nice that you want to connect with patients and like really have that deep connection and help them. And then also exploring different fields and not just sticking to one thing is really inspiring too.
Yeah, absolutely.
I'll pass this back to Liz for our second to last question.
Sure.
I'll be asking my actual question now. Our club is committed to helping our members secure valuable volunteer positions at hospitals. Can you share your experiences with volunteering or internships that are pivotal in your career development, and how can aspiring medical professionals navigate similar opportunities?
So another great question. So you have to kind of, depending on where area you live in, when I was in college, I volunteered at the Children's National Medical Center, basically helping low-income families coordinate with available governmental programs to help them with food assistance, education assistance, even transportation, vouchers that the government provides. I was also an EMT as well, in college. So those are the ways I kept up with the community service per se. As in high school, you guys are very early. It's great. Look into your senior homes, your nursing facilities. There are a lot of fortunately patients or elderly that are lonely. They need just someone to talk to, someone to listen to them. And that goes a long way, and that'll also kind of help you, and you develop your empathy skills and dealing with a growing elderly population. If you're interested more so, just look into being EMT as well. It's a great way. You can start even in high school. You can take the course, you can pass the exams, you can ride along the ambulance, get actual valuable skills that you'll use, and once you're actually in medical school and as a practicing physician.
Thank you for sharing that. It's very important that people understand where to get volunteer positions and where to start. And I actually have a few connections that are in an EMT program in my old school. So it was very nice for you to share that. Thank you.
Thank you. Thank you.
Hi, so I'm back with our last question. So,
Absolutely.
Dr. Qureshi, as I was reviewing your impressive background, I observed that you pursued a master's degree before attending medical school, and you have achieved double board certification in anesthesiology and pain medicine. It's evident that you prioritized expanding your CV. Considering the additional time and effort invested in obtaining these qualifications, could you share your perspective on whether the benefits of this extended academic journey were worth the delay in launching your medical career?
So that's a great question, and when you apply for college, when you get to college, especially if you're dedicated to medicine, first I would say for you guys, look into 6-year medical programs, the combined medical programs, if you are certain that that's what you want to do. For myself, I knew I wanted to do medicine, but unfortunately I wasn't, I picked a very hard major, which is biochemistry. So my GPA at the end was not the strongest. So I had to kind of do this additional master's to bring up my science GPA so I can apply to medical schools. So when you start college, just don't pick what you think the med schools are going to like. Pick something that you're actually interested in. Like a lot of you just have to fill the pre-medicine requirements. You don't have to major in biology. You don't have to major in biochemistry. You don't have to major in physics, but pick something that you really are interested in and pursue that, because that's how you'll do well. So, for instance, some of my friends did dance. They did arts. They did math. They did American history. So, but you can still do those things, and as long as you feel like your prerequisite requirements for pre-medicine, a lot of schools really. If you really like biochemistry, you should definitely pursue that, especially if you want to do advanced research, all those things. For me, I made the mistake of not knowing, picking a major, and obviously it's tough. So my GPA was not the best, and that's why I pursued the master's. And even during the master's, it really gave me a solid foundation to kind of deal with the rigorous study or coursework in medical school, and then I did really well in medical school because of that.
Yeah, I really agree with that. I recently, at my school, we had a Harvard campus visit, and it was a young girl who was a student there who kind of ran it, and I really liked how she wants to be a doctor, and she's on the pre-med track, but she wasn't, like you said, only taking biomed or biochemistry. She was actually taking, I think, human evolution and neuroscience.
Yeah.
So that kind of opened my eyes that you don't have to, even though you know that what you want to be, it's always nice to be able to explore other options, because you
Yes.
can never be too sure unless you've checked through and saw through every option.
Absolutely. Do it. So always do it in what you like, what really drives you, and what makes you happy.
Yeah, I completely agree with that. Thank you so much for taking the time again for our meeting. I really appreciate it. I feel like we all kind of learned something new, that kind of got a little bit of new advice for our pre-med journey. So thank you for that. And
My
I hope you
pleasure.
have a great day. Nice to talk to you.
Thank you. Take care. Have a good rest of the day.
Thank you. Bye.
Bye-bye.